We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and globally on the iHeartRadio app. Welcome to Doctors Are People Too. Now live on WWNN 95.3 FM and 1470 AM. Glad to be a part of it. And then also streaming on Facebook, amp2.tv's Facebook page, amp2.tv YouTube. I mean, we're everywhere with this show on Doctors Are People Too. So, before I waste any more time, I want to welcome Dr. Bruce Zarrett, neurologist with Sunrise Medical Group. And we're going to talk a little bit about all of his areas of interest, and especially a dizziness center that he's starting. Dr. Zarrett, how are you doing tonight?
Great. Thank you.
Thanks for coming on Doctors Are People Too. I do appreciate it. Let's get right into it. I know you have some very exciting news to share about a dizziness center to help anyone suffering from dizziness and vertigo. How did this come about, and who's it going to help out treating dizziness?
As a neurologist, I come to treat the patients from a different perspective than the ear, nose, and throat physicians. And we see many people who really have, quote, dizziness, which are have nothing to do with ear function. And this has led to try to provide an integrated service for patients that, as I say, approaches the patient from a different perspective, the neurological perspective, where there's a large population of patients who come in sent by their PCPs, internists, cardiologists, who have recurrent falls, who are complaining of lightheadedness, who complain of feeling off balance, who complain of spinning. And the first job and the first thing that I attempt to establish from the patient is, without using the word dizzy, what are they actually experiencing? And that divides the patients up into different groups, some of which may be considered more primary ear, nose, and throat, some of which are related to problems with patients not being able to tell where their feet are. So as they walk around, they're off balance. This is a very common complaint for people with diabetic neuropathies. People who are lightheaded, where they say, I'm dizzy when I get up, and in reality what they're having problems with is the blood pressure. And we spend a lot of time evaluating each individual patient, so that's how the process has evolved over time.
And this is a dizziness center that the patient actually comes to you at the office at Sunrise Medical Group, where your office is located. They actually come there? Correct.
Patient comes to the office, and I evaluate the patient. Usually it's a 45-minute visit where I take the history and do a full what's called a neurovestibular evaluation, including checking blood pressures in different positions, checking balance, doing a variety of maneuvers to see if the patients have provocation of symptoms by moving their head or body or laying down. So we're looking to try and make a clinical diagnosis and then try to use ancillary testing to prove or disprove the hypotheses so that you can set up a treatment plan. One of my old professors used to say that the first part of treatment is an accurate diagnosis, and nothing could be further from the truth.
Okay, so that first visit, that's the most important part to set up that, I guess a baseline.
Correct.
Of where you're at. Okay, what are some of the things that patients tell you when you ask them to explain the dizziness without using the word dizziness? I mean, is it?
There's all sorts of things, but I try to help them and say that most people usually use one of the following sets of examples: that they're swaying, or they're off balance, or they can't tell where their feet are, or things are actually rotating, or they just feel like they're lightheaded, and whether that's when they're changing position or whether they're stable. That usually helps a lot, because people's abilities to actually communicate what their symptoms are in a way that a third party can understand sometimes are limited, but it makes a huge difference as to what's wrong with them and how to pursue a treatment.
Mm-hmm. And now, how does, I know you're an expert in neurophysiology, how does dizziness occur in the brain or the body? I mean, what makes us dizzy?
Well, for the quote lightheaded group, it's a reduction in blood flow to the brain. We see this in people who are taking too many diuretics or too much blood pressure medicine, or people have disorders where they're not able to maintain a blood pressure because their body's reflexes are deficient, like in diabetes. There are patients who have reduced blood flow into certain areas of the brain, called the brain stem, and they can be part of mini strokes, TIAs. Migraine patients can also have a much higher incidence of vertigo than the population at large, and it's a migraine phenomenon. People who have degenerative disorders, where they have balance problems, Parkinson's, people with multiple strokes, MS patients. And then there is I'll call it the ear group of people with more standard vertigo, the biggest group being positional vertigo, where patients report that if they lie down in a certain position, things start to spin, or if they roll over in bed, things start to spin, or they move their head up or down as they're going down looking for the tomato paste in the supermarket. And just these head movements will bring on feelings that they're spinning. And we're using the exam to try and break the patients out into these subgroups.
Now, that spinning, when it's an uncontrollable spinning and the patient can't stop, or the individual can't stop the spinning, and then they come to you, how are you able to, I guess, stop the spinning? What is the treatment options? Obviously, they have to see you in that initial exam, but is that treated by medicine? Are there other treatment options?
Well, for true vertigo, which is really defined as a sensation of movement or spinning, the question becomes, what's the cause? If the patients have structural problems in their brain tissue, then it can be very difficult to stop the spinning, so to speak. And we can use medicines like Anavert, Dramamine, Valium, which is a very excellent vestibular suppressant. But we have to use therapy in large part to help patients be safe, whether that's an appliance, whether they're exercises. The goal is to stop people from falling with all the attendant problems that they get from the falls themselves. We then treat the underlying conditions, and for the positional vertigo patients, there are a variety of maneuvers that can be done right at the bedside. Very often when I see the patient on the first visit, if I can elicit their vertigo by lying them down or rolling them over, I can diagnose them and treat them right on the spot. And the maneuvers work 70% of the first time you do them, and the patient is put into remission.
Wow. Unbelievable. I kind of see that with when I'm watching the Animal Planet, when they roll the shark over and then it just goes into that state. But no, it's a lot different. Obviously, that's not to be funny. No, you can actually roll them over and then diagnose it right there, and then be able to help out that way. We're here with Dr. Bruce Zaret. He's a neurologist at Sunrise Medical Group. His number is 954-321-1776. Located at 3540 North Pine Island Road in Sunrise. And the website is sunrisepractices.com. You just type in sunrisepractices.com. Dr. Zert, let me ask you about the Dizziness Center. What physician specialties would be ideal to collaborate or refer to the Dizziness Center?
I see patients referred by general practitioners, PCPs, internal medicine physicians, cardiologists. I see patients who come from ENT physicians where the problem is not a primary ear problem, and the opposite is true in instances where there's a high clinical suspicion that they have a primary ENT problem, like Meniere's disease. Even though I may do an intake, I route the patient appropriately back to ENT physician. So that's sort of a two-way street. Many of the patients, and again, this all comes in when the patients tell their doctors they're dizzy, but their doctors may not go so far as to actually understand what they're really complaining of.
Mm-hmm. What the problem actually is. I want to get to the on-site diagnostic services offered at the Dizziness Center, but let's take a quick break and we'll be right back. We'll talk about all the ways Dr. Zert is helping people with vertigo, dizziness at Sunrise Medical Group, and we'll be right back on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Yeah, it's tough to find. And we're back on Doctors Are People Too. And that's okay because Dr. Zert, my director of marketing, just texted me and said she was just going through the stations and actually came across us on 95.3 FM. So there are people listening. That's good to hear. And my boss, it doesn't hurt that.
Absolutely.
But we were leaving off. What are the on-site diagnostic services? I can't pronounce that word today. What are the on-site diagnostic services offered at the Dizziness Center here at Sunrise Medical Group?
Well, the office in Sunrise is a pretty spacious office. It's about 16,500 square feet. And housed in that office, we have our own MRI where we do MRIs of brain, MRIs of the area where the nerves go out to the ears. We do MRAs, which are basically MRIs of the blood vessels. We do electrical tests that measure sensory function in a person's legs, which is applicable for people who are walking to the bathroom at night without the light on and they're bumping into things and falling because they don't know where their feet are, or somebody who's closes their eyes in the shower and falls over. We also do, in the office, electrical tests that measure the balance function of the ears using an unusual looking gadget that measures eye movements with a person wearing goggles where they can't focus, and we move them around and put hot and cold air and water in their ears to stimulate and measure how the ears work. We also do blood vessel studies, ultrasounds. It boils down to you need two or three things present to maintain your balance. You have to know where your feet are, assuming you're on your feet. You have to get information from your ears to tell you where you are, whether you're moving right, left, up, down, and you need vision. And if you need at least two of the three working at any time, and once you get down to one out of the three, you're going to be off balance. And then, of course, you need normal brain tissue to take the data and make sense of it. So the tests look at these different areas of strengths or weaknesses to try and sort out who's got what, because the treatment paradigms are different as to whether it's ear-related or lack of sensation related, or patients off balance because they have a degenerative disease like Parkinson's or other rare conditions. Balance problems are very common in MS patients. So this is a problem which is very prevalent. Dizziness and headache are the two major symptoms, neurological symptoms, that make people go to a physician.
Wow. And I remember early on in life, my grandmother had vertigo, so I was able to, unfortunately, see that. But like another thing you said, when off balance is a key word here. Now, when people are off balance, they can fall, they can hit their head, they can break bones.
Correct.
And as people get older, especially with people with like osteoporosis, the bones break easily. So this is something that definitely people or if a family member has someone going through this, that they should have checked out. And then you ended there with like the number one reasons why people see a physician are, dizziness,
neurologically,
headache.
yes, absolutely.
Neurologically. Now, we talked about some of the diagnostic services offered at your Sunrise Medical Group office and your dizziness center. What types of on-site therapy do you offer at the dizziness center and Sunrise Medical Group?
Well, as I say, I myself perform what are called repositioning maneuvers to try and move, and people who have these positional vertigos, to move some of these crystals. I always tell the patients we can't get them out of their body, but we can move them next door to another room where they're not going to bother you. And these are simple bedside things that can be extremely effective and work immediately. It of course depends on what's going on with the patient, but there's specialized physical therapy to work with people's balance, teaching them how to use an appliance if they need to. It's not enough to give somebody a cane and expect that they're going to use it properly, or give them a walker and expect that they're going to use it properly. If the patients really, many patients do not find it that the use of appliances are intuitive, and they require treatment. And there are a series of eye movements to retrain patients. The eyes are extremely important in balance control. It's a complicated area of balance and vestibular therapy that the physical therapists do. And again, I do a lot of the repositioning stuff on my own. I have the patient there, I elicit their symptom and then go ahead and just treat them right on the spot.
And then one of those treatments I was asking you before the program is the log roll treatment.
That's for one of the specific kinds of the specific kind or one of the canals that's involved. There are 3 canals that are set up like in an XYZ a plane, and if one of the canals is either under functioning or over functioning, your brain really doesn't like that, and the trick is to try to fix that if you can.
Mm-hmm. And we're here with Dr. Bruce Zarrett, a neurologist with Sunrise Medical Group. His number is 954-321-1776. Dr. Zarrett is located at 3540 North Pine Island Road in Sunrise. He does get a lot of patients from Palm Beach County, obviously a lot from Broward and Miami-Dade. The website is sunrisepractices.com. You're going to type in the word sunrise and then practices.com, and you'll find it very easily there. One other thing I wanted to just point out is you were telling us that tests like MRI, physical therapy, the dizziness center, these are all done on site right there at Sunrise Medical Group in this location.
That's
at this
correct.
address. So you don't have to be sent out for an MRI over here, physical therapy over here. That makes it a lot easier.
Insurance allowing, but yes.
Insurance allowing, okay. Now, I want to ask you a couple questions. We have a few more minutes on the other areas of interest you treat. We talked a little bit about headaches, and then on a couple others are muscular dystrophy, multiple sclerosis, obviously vertigo, and epilepsy, because you're a neurophysiologist, so you're an epileptologist too, so you treat epilepsy as well.
That's correct, right.
Okay.
Clinical neurophysiology really is a term that applies to using testing that measures electrical function of brain, peripheral nerves, muscle, ears, and the different kinds of tests that are aligned with that. Epilepsy, I'm a board-certified electroencephalographer. I've been interested in epilepsy my entire 42-year career, and have run services for all the epilepsy services for Broward County for a number of years and continue to be very interested in epilepsy. Vertigo is another way that looks at a different part of the physiological system, and I also do EMG NCVs, which are basic tests that look how the peripheral nerves and muscles work and function, which is relevant for people with hand and leg problems, spinal problems, look at nerve roots, look at carpal tunnel, look at entrapped nerves in the feet, look at diabetic neuropathies, and so forth. We look at muscle function. And these are all various tests that are part of clinical neurology, but not everybody does or specializes in some of this.
And for the EMG NCV testing, you're working with teams of hand surgeons and podiatrists as well in the community?
Right. They're not present in the office, but I do a tremendous amount of work from hand surgeons and podiatrists so that we can document that they have carpal tunnel. What's the severity? Is their hand symptom from their neck? Is it from their hand? Same in the leg. If there are symptoms in the feet, or is it really coming from the back? Is it not coming from the back? Is it a trapped nerve in the ankle, and so forth? So it's important part of the evaluation process for the patients. And certainly if patients are going to have surgery, you want to be 100% sure that they need surgery and that you're proceeding with the appropriate diagnosis.
Wow, you investigate so many different things. I mean, it's amazing. And we were talking earlier before also, you're also popular in the courts. You've done a lot of, been on the stand, giving out the info on different types of cases. Not so much that you do it so much anymore, but you've done that in the past as well.
Yes, I've
been on a few cases.
Quite a few through the years.
Well, we have a couple more minutes. I want to ask you a little bit about your hobbies and passions outside of medicine. This is always my favorite question. It's kind of the curveball question because we never know what kind of answer we're going to get. We've had a cardiac surgeon who's obviously a marathon runner, runs to get away. But what is your thing outside the office that you do to kind of get away from all of this testing, treatment, dizziness treatments, vertigo treatments, etc.?
I grow bromeliads.
Wow.
And at the beginning of the year, I had somewhere approximately 1,500 plants, probably close to 500 to 600 species. Grow them, hybridize them, make new plants, brand new species, hybrids. Plants are great. I like working in the soil. Mm-hmm. It's very relaxing, and it's very interesting. And I'm a member, and I just up until recently was on the board of directors for the Broward County Bromeliad Society, and I find it very relaxing and very interesting.
Nice getaway. So we can definitely say that you have a green thumb then. 1,500's a lot.
Yes.
I'm growing like 15 pineapples, and I get like one a year.
They're bromeliads.
Really?
Yes.
Okay. Wow, I learned something. I learned a lot tonight, but another thing about pineapples. Yeah, I started, I live near an area of Delray. I actually live in Boynton Beach, but 2 miles from Pineapple Grove. So I just, my wife's a pastry chef. I started cutting off the tops of pineapples and planting them. After 3 years, I got 4 pineapples in 1 year. And then this year, I haven't got any. It's the weirdest thing. I got them after very heavy rainstorms. I don't know if that had something to do with it or...
Can't answer that.
No. And you need a decent-sized property to grow bromeliads, right?
Some of the plants are really quite large. Mm-hmm. Some are really quite small, but you need a lot of water and you need space.
And how is South Florida for growing that type of plant?
There's probably no better place in the country to grow bromeliads than Florida.
Wow. And then you were telling me earlier, Costa Rica would probably be the only better place than South Florida.
Most of these plants come from Venezuela, Colombia, Costa Rica. They're all in Brazil. So they're North, South America, Caribbean. But Florida is as close. It's the best place within the states, except perhaps Hawaii also has an ideal climate for bromeliads too.
Oh, I did see them. I had a chance to go to Hawaii a couple years ago, and I did see a lot of them there.
Yeah.
And now it's bringing back memories. Well, thank you so much for coming on Doctors Are People Too. I've never got over so much material in 30 minutes with a physician, so I really appreciate it. Thank you.
You're very welcome. Thank you.
And that's Dr. Bruce Zarrett with Sunrise Medical Group. Website is sunrisepractices.com. Number's 954-321-1776. And he has a dizziness center there at Sunrise Medical Group, 3540 North Pine Island Road in Sunrise. And we'll be right back on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Bayo was on call. He was who performed my surgery. I describe like an angel. I describe like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red one, that light red one. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life. and had to take advantage of this.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too, and now on 95.3 FM and 1470 AM, both WWNN stations. And on Facebook, we're Facebook streaming live via AMP2 TV Productions, and this is going to be posted on amp2.tv's YouTube page as well later in the week. For the second half of the program, we're going to have an orthopedic surgeon from the Miami area talk to us a little bit about orthopedic surgery today, and also a very interesting hobby he has outside of medicine. But we're going to hold off on that for a couple minutes, but that's going to be something I'm really looking forward to. So I want to welcome to the program Dr. Gilbert Buperthy Rojas. I hope I didn't mess up that pronunciation as well at all. Dr. Buperthy, how are you doing tonight?
Good, David. Thank you for having me.
Let me ask you, we talked a little bit over the weekend, but I never asked you, where does the name Buperthy come from? What nationality is that? That's a very unique last name, and I hope I didn't butcher it too much. Please correct me if I did.
Well, you didn't butcher it too much. It's a French last name, and it's really pronounced Beaupertuis, not Buperthy, but Beaupertuis.
Beaupertuis.
So the EAU should sound like the letter O. Beaupertuis, yes.
Beaupertuis, okay, and it's from. You have a French background.
I have a French background. My father's from the French West Indies. My mother was Cuban, and that's how you get the Beaupertuis Rojas.
Awesome. And this is my first year in radio, so I probably should have asked you that before the show, but I'm glad we got that taken care of, Dr. Beaupertuis.
Yeah. No problem on that. Believe me, the name has been butchered many a time, so I'm accustomed to it already.
And you're a board-certified orthopedic surgeon. We came in contact because I know you do some of your work at Coral Gables Hospital and other local hospitals. But another interesting thing I always like to ask when we have these type of physicians on the program is you're a DO, or Doctor of Osteopathic Medicine. And for me and the listeners, can you explain a little bit about a Doctor of Osteopathic Medicine versus when we see MD or Doctor of Medicine?
Sure. DOs are fully licensed physicians, just like our MD counterparts. We go through 4 years of medical school, just like our MD counterparts, studying the same books and taking the same exams. The only difference that exists between the two of us is one is during our medical school training, there's a huge emphasis on holistic medicine, on treating the patient as a whole person and not just a particular body part. And then secondly, we learned musculoskeletal manipulation. In addition to our regular classwork, we learn how to manipulate the musculoskeletal system for certain ailments to get people to feel better.
Now, it's called musculoskeletal manipulation, and what is that exactly?
Well, it's really called osteopathic manipulative therapy, and those are situations where we use manipulation in treating patients. I'll give you an example. Back pain is probably the number one complaint of patients in the U.S. across the board, from seeing their physicians to going to the emergency room, going to urgent care centers, or even going to the pharmacy to pick up medicines is number one complaint. And if you can find a physician who does manipulative therapy, that's a great adjuvant to the current medications that are available to help people get rid of their pain. In addition to that, people that have lung problems, per se, if you can find a physician who does manipulative medicine, they can help expand the intercostal muscles so these patients are able to breathe better. Patients that have chronic headaches, some people with headaches, manipulative medicine helps for that. So there's different ailments and where manipulative medicine could help patients feel better and get better. In addition, using it as an adjuvant to current medications that are available to us.
So is it actually a hands-on treatment then?
It is a hands-on treatment. Yes, definitely a hands-on treatment. You need to find somebody who does it. We are exposed to it during our medical school training, but certainly if you're going to continue to use this type of treatment in your practice, one is you need to be using it all the time, and two is just like any other specialty, you need a special and additional training after your medical school years to be a perfectionist with it.
Wow, I'm learning so much tonight on the show Doctors Are People Too, and I know I'm the host, but I know other people driving around are learning so much as well. Thank you for going so in depth in the DO versus MD and musculoskeletal manipulation. That is really neat. I didn't know that.
Well, there you go. You learn something every day.
Yeah, and that's important in life. I mean, you got to continue learning. I mean, education, whatever you're interested in, and is important. Let me you talked briefly about the back, and I watch a lot of football, and I know the New England Patriots tight end Rob Gronkowski. He was running towards the end zone about a week ago and had a horrible fall, and he ruptured a disc in his back. What type of injury is that? And I know you don't see that patient regularly in the office, but how long do you think until an athlete can come back from something like a ruptured disc?
Well, it sounds to me like he ruptured his disc, meaning that the contents of the disc came out of its envelope and was pressing on the nerve in his back, which would result in pain shooting down his leg. And that pain can become excruciating, where he would be unable to perform any type of physical activity. And I'm sure that's the reason why they did the surgery. As far as recovery time on that is concerned, it's depending on how extensive the surgery is as to what they needed to do. And they've got him out for the season, so I've got a feeling that it was a little bit more involved in his case than just removing the disc material.
Okay, I had to ask. He's not on my fantasy football team or anything, but I had to ask.
Yeah, if he's on it, take him off.
Yeah, I got to take the opportunity when I have doctors on the program. Let me ask you a little bit more. I know you're on staff at several local hospitals. One of them is Coral Gables Hospital there in Miami, actually, 3100 Douglas Road in Coral Gables. I'm sorry. And the actual address is Coral Gables. Their number's 305-445-8461. And I'm looking at their website right now. Great website, coralgableshospital.com. What types of orthopedic services are available at Coral Gables Hospital?
Well, it's a full-service hospital, and as far as the orthopedic services are concerned, we do all kind of orthopedic surgery there, from sports medicine with ligament and tendon reconstruction to shoulder surgery with a rotator cuff repair and shoulder arthroplasty to hip and knee replacement surgery. And we also have spine surgeons that do back surgery. So we do all kind of musculoskeletal surgery at Coral Gables Hospital.
And now we got a couple minutes before our first break, but the specialized care that you provide, I believe, is for the hip. So you can tell us. Can you tell us a little bit more about in terms of total hip replacement? I know you do knee replacement as well. That's going to be my next question. But in terms of total hip replacement, Who is a candidate for that type of surgery? Do you actually replace the entire hip? I'm always confused about that. And what are the typical outcomes?
Sure. Hip replacement surgery is performed on patients that have severe degenerative arthritic conditions in their hip. And one of the things patients need to realize is I get a lot of confusion here in the Miami area as far as hip pain is concerned. A lot of times people start pointing to their lower back as complaining of their hip, and that's not necessarily the hip area. Your low back area is your lumbar spine. It's a very common cause of injury, a common cause of pain, like I spoke about in the beginning of this talk. Hip pain is usually noted to be in the groin area, and the patients will have trouble getting out of chairs, getting up from a seated position, getting out of a car, going up or down stairs, and they'll feel the pain predominantly in their groin, sometimes in their buttock area also. Sometimes the pain radiates into their knee. And what happens is they get degeneration of the cartilage wears out, and they end up with bone rubbing on bone. And in those situations, no injections, no pills will really give them any significant relief. And then they're looking at possibly a hip replacement. And in hip replacement surgery, one goes in and removes the arthritic component, meaning the ball of the femur, along with the socket in the pelvis. And it's replaced with a metal socket and a metal ball. Some interesting new technology that is available to us now is called a mobile bearing hip. And that essentially is a hip replacement where we have motion in multiple areas of the socket joint. And that results in patients having greater range of motion and a more natural functioning hip, if you will, closer to their normal anatomy than a standard hip replacement.
I didn't know that you can feel hip pain in the groin. I've been lucky enough not to feel it, but yeah, that's definitely something that I didn't know. Again, I'm learning a lot, but that's actually something that's a symptom of a hip problem.
Yes, and a symptom of a hip problem was you usually feel it in the groin area, and sometimes it radiates to the knee because there's a nerve that passes by in that area that gets irritated, and patients will be complaining of knee pain. A physician will focus on the knee, they take x-rays, they do MRIs, and this knee is essentially normal, and you're wondering what the heck's going on. Well, you better check the hip, because I bet you anything that pathology will be right there in the hip area, and you'll have the solution for them. Patients get kind of confused with that, and they're saying, well, I don't feel it in my hip area, I feel it in my knee, but it's the pathologies in the knee area in the hip area where things are, gone askew.
Dr. Beaupertuis, hold that thought on knees for a second. We're going to be right back on Doctors Are People Too.
Okay.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary heart disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain. so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultramonitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back with Dr. Gilbert Beaupertuis Rojas, a board-certified orthopedic surgeon on staff at Coral Gables Hospital and other local hospitals. Coral Gables Hospital numbers 305-445-8461, located at 3100 Douglas Road in Coral Gables. Dr. Beaupertuis, I wanted to ask you also before the break a little bit about knee replacements, and also if you could explain the type of knee replacement you do, and then also the who is a candidate for a partial knee replacement as well.
Sure. Well, there's different knee replacements like you just mentioned. One is a partial knee replacement and one is a total knee replacement. A partial knee replacement is reserved for that patient that has a condition or an arthritic condition in their knee, just in one section of their knee. And it's usually on the inside area of the knee. It is normally performed on patients that are younger, probably under the age of 65. It's less invasive. Recovery is a little bit faster because, again, we're just working on one small area of the knee. It's a smaller incision, usually an overnight surgery, sometimes even a same-day kind of a procedure. The total knee replacement is exactly what it sounds like. It's a larger opening, and we're replacing the whole knee. We're replacing the end of the femur, the distal aspect of the femur, and the proximal or the top part of the tibia bone. And we're replacing it with two metal caps, and then a plastic liner goes between those two metal caps, and that would be the total knee replacement.
Now, do you do shoulder replacements as well at the hospital in your practice?
Sure, we do shoulder replacements also. I do shoulder replacements also. There's different kinds of shoulder replacements. One type of shoulder replacement is, they're both for arthritic conditions, but one type of shoulder replacement is where the patient still has a rotator cuff. The tendons are still intact, and they have developed arthritis within the joint of the shoulder, meaning, and all the soft tissues, meaning the rotator cuff tendons, are still functioning normal. There's another type of shoulder replacement called a reverse shoulder replacement, in where we change the biomechanics, if you will, of the implant. And that is a procedure that's done on patients that have lost the function of their rotator cuff. It's either chronically torn, which is normally the case, and then the patient has developed an arthritic condition in their shoulder as a result of that. And then we do what we call the reverse shoulder replacement.
And you just mentioned arthritis, and that actually was something I wanted to ask about. Is there a non-operative management available for arthritis?
Absolutely. There's different degrees of arthritis. Arthritis essentially means that there's degeneration within a particular joint, and it could be any joint in the body. It means that the cartilage in the joint is wearing. It's that white glistening surface that you can see at the end of a soup bone. Well, basically, we have the same type of a cartilage in our bones. And as that starts to degenerate, you start developing pain. So for the milder courses of arthritis, we take anti-inflammatories such as your basic Aleve or Advil to see if that helps. As the arthritis progresses, sometimes those medicines aren't sufficient, and we can have injections, cortisone injections, and these type of things gives you temporary relief of the pain. They're not cures. Some new technology is being developed now, or we're using now to help patients with their pain, and you'll hear about stem cell treatment or platelet-rich plasma treatment for arthritic conditions also, and that's another treatment armamentarium that we have for arthritic conditions.
Now, those are treatments that can be done actually in the medical office, in the doctor's office?
Yes, absolutely. The platelet-rich plasma treatment is a form of treatment where we would remove some blood from the patient, their own blood, and it gets centrifuged down, and we separate the blood products. We separate the plasma with the platelets, and then we'll take that and we'll inject that back into the patient. And the benefit of that is that platelets have a growth factors in them and anti-inflammatory factors in them that help reduce pain and technically help reduce tissues. The platelet-rich plasma can be used both in arthritic conditions and in tendinopathies in the patient. And it's important to realize that we've discovered more and more with this platelet-rich plasma that there's two different forms. There's a form where we use a leukocyte poor and leukocyte rich, meaning the amount of white blood cells that are within the concentrate that we inject. And we now know that if we're injecting in a arthritic joint, we want to use leukocyte poor platelet-rich plasma, and if we're injecting into an inflamed tendon, we want to use leukocyte-rich. So it's important that the physician who's performing these types of treatment is aware of this also and is using the right technique for the particular condition on the patient.
And we're here with Dr. Gilbert Beaupertuis on staff at Coral Gables Hospital. But you also have an office in the Miami area, Lejeune Orthopedic Associates. Can you tell me about your office-based practice? I know we've been talking a lot about the treatments you do there in the last few questions, but take us into the doors of Lejeune Orthopedic Associates.
Sure. Lejeune Orthopedic Associates has been in the community now for over 30 years. Personally, I've been practicing there now for over 20 years. We are centrally located in Miami right off of a major expressway, short miles from downtown, from the airport, from the South Miami area. So we're centrally located. And we basically are a general orthopedic practice where we see all sorts of ailments and are able to treat most of these ailments within our office, the specialists that we have in our office. And if not, we have different colleagues that we refer the patients out if necessary. Again, we've been in practice now for many years and have a vast amount of experience in treating orthopedic ailments.
And that's Lejeune Orthopedic Associates, 351 Northwest Lejeune Road, Suite 205 in Miami. Phone number is 305-649-2133. And I'm actually on their website right now. Great website, LejeuneOrthopedics.com. Lejeune is spelled Lejeune, and then spelled orthopedics in the American way, not the English way, ORTHOPEDICS.com. So LejeuneOrthopedics.com. Dr. Beaupertuis, this is the question that I've been waiting to get to. What takes up your time, or better yet, is your passion outside of medicine?
Great question. Well, that has now become triathlon. I would consider myself a seasoned triathlete, participating in triathlon events now for the past 7 years. And I just completed my first full Ironman triathlon several weeks ago, so that was quite an endeavor for me.
Congratulations on that. That was you were telling me that was in Florida?
That was in Florida. That was in Panama City, Florida, on November the 5th. It was quite a grueling race, but I finished it in the allotted time, and I can consider myself now an Ironman.
We only have a few 30 seconds here. When do you train for triathlons?
Oh, I do it in the morning, as my afternoons can get complicated, and it's every day swim, bike, or run. Swim, bike, or run.
That's amazing. That is a dedicated orthopedic surgeon doing his training for triathlons before work. Amazing. Dr. Gilbert Beaupertuis, thank you so much for coming on Doctors Are People Too. I really appreciate it and can't wait to have you on in the future.
Thanks a lot, David. Appreciate having me on.
Thank you, and good night.
Good night.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff,